So I'm going to be talking about health benefits and disadvantages of caffeine. One benefit is that it can improve the effects of pain relievers. So it's a main ingredient found in pain relievers like ibuprofen and other pain relief medications. And for example, what it does is in drinks that contain caffeine like coffee, the chemical will bind to receptors called adenosine receptors, and those are the ones that play a role in pain relief. Caffeine in drinks like coffee, for example, can also stimulate the release of dopamine receptors and beta endorphins, which also act as pain relief in the body. And it's also known to reduce inflammation as a whole, which is also something that obviously causes pain in your body. And research has shown that caffeine can reduce an after-workout muscle soreness by about 50%. I thought this was pretty surprising myself. So also, obviously, caffeine can temporarily improve tiredness and increase focus and concentration. I put temporarily in parentheses because caffeine can also come with a crash effect, which means if you're having too much or drinking it at a certain period of the day at a certain speed, you can also crash with that increased focus, which means like you'll be more tired than when you started, or if you have a lack of caffeine, you'll be more tired than you would be. It also improves mood, reaction times, and general mental function. And I also found that it can help you lose weight. I didn't realize that it was such a main chemical in fat burning supplements, and it also boosts your metabolic rate. Some disadvantages. It can obviously impair sleep and mess up your sleep pattern depending on when you're drinking it. Because it does block those adenosine receptors, that chemical in the brain that makes you feel tired, and with that trigger of release of adrenaline, which increases energy, it could definitely mess up your sleep schedule depending on when you're drinking coffee. It also causes a jittery feeling and can enhance anxiety and panic attacks for people who do struggle more with anxiety. What happens is it activates your fight or flight response, and a combination of the adrenaline and alertness that it causes in your body can make your body feel like it's in a threatening situation, which is a result of increased anxiety. And obviously, if you're a coffee drinker, caffeine drinker, you know that it can be really addictive. Without it, you can go through severe withdrawal symptoms. And habitual consumption will also obviously cause your body to build up a tolerance to caffeine for you to feel its effects, like pain relief, attention focus, and relief from drowsiness. If you don't get enough, you won't feel it, and as you keep building your tolerance up to it, you won't really be able to function without it. So going on to pathological impacts of caffeine on the brain, it can act as an antioxidant to prevent disease. Chlorogenic acid, caffeic acid, and melatonin can be found in drinks like coffee, and these antioxidants are known to protect against heart disease, liver disease, and different types of cancer. They're also known to decrease your likelihood of Parkinson's disease. Caffeine releases more dopamine generating neurons, which if you are receptive to Parkinson's disease, those dopamine generating neurons are not being released as much in your body, so it can kind of decrease your chances of developing that. It can also inhibit vitamin D receptors, and vitamin D, obviously, we know that's good for your healthy bone structure in your body. It's also helpful to absorb calcium in your body, which is needed for strong bones and kidney function and a lot of other functions in your body. We know from learning in this class that calcium is really important for your brain and for your body. So without vitamin D, the body obviously lacks the calcium it needs, and it can suffer from bone mineral density, which ultimately causes an increased risk for osteoporosis development. And lastly, caffeine can prevent memory decline. It has been found that it can prevent development of spatial memory, but also increase like pattern separation in people in long-term memory. So evidence shows that caffeine can also enhance long-term memory. We've previously known that it can enhance short-term memory, but it's recently been found that it can also play a role in enhancing your long-term memory, which, with all of this being said, this can prevent diseases like Alzheimer's and dementia. Over to the right, I have another little chart about the pros and cons of coffee consumption. I know we're probably all, or most of us, are coffee drinkers at some capacity, some more than others, but some other effects of caffeine and coffee and caffeine and pop and other drinks is it can raise your blood pressure, it can cause dehydration. Caffeine has a diuretic effect, which is something that leads to an increase in urination, which can, cause dehydration to happen faster, and it can also be the reason that you're losing those vitamin D receptors and other minerals in your body, like vitamin D and vitamin C. And also, if you do suffer from heartburn, it can also aggravate heartburn. And that's it.